Welcome to the Senior Moment. This is Connie Clark with Home Helpers, and today in the studio with me I have Lynne Kinson. I happened to catch a video of a presentation that she did at Pilgrim's Market. I guess it was several months ago on osteoporosis, and I watched it and was very intrigued on all the things she was saying, and I thought this would be something that would be perfect to talk about on the Senior Moment. So I asked her to come join me today, and she said yes, and I'm so excited. Welcome, Lynne.
Thank you, Connie.
Lynne, I've got your card here, and it's got this whole long list of your certified physiologist.
Exercise physiologist.
Okay, physiologist. You're a certified health and wellness coach, nutrition and diabetes educator, and a corporate wellness program coach. So you've got a lot of credentials behind you and information behind you to talk about this subject.
That's true. And I, not only education-wise, but experience-wise as well. And some of my previous experience would include running a cardiac rehab program down at Gritman Medical Center. I also created a diabetes education program because a lot of our women would go in and have DEXA scans, and they would get their results back, and the doctor would say, well, it's okay, or maybe it's not so good, we want to start you on this medication, but they really wouldn't understand the whole gamut of what they were dealing with. And so in response to that, we started an education program where myself, a dietitian, a pharmacist and a physical therapist would talk to them about risk factors, about what they could do to improve their bone density, and give them some options out there. And so I've kind of taken that and even, expanded it from there. And then we also started an exercise class as well, because exercise is so important for osteoporosis and preventing more deterioration of bone, as well as just preventing osteoporosis.
Well, I learned a lot watching that video, and I was so glad that they did videotape it and put it online because it was just amazing. So we're going to hit some of those highlights. I made some notes to kind of prompt you as we go along. And one of the first things you talked about was describing the bone physiology.
Right. Bones, when we think about bones, we often think about that skeleton that was in our chemistry or biology lab in the corner, and we think of it as hard, solid material, and it really isn't. It is living, growing, changing tissue. And that's the big word right there, is changing, because our bones are constantly building and breaking down, and we call this remodeling. And there's two types of cells. There's what we call our osteoclasts that break the bone down, and our osteoblasts that build the bone up. And there are different things in our life that affect those two bones, and about every 10 years our whole skeleton is remodeled.
Yeah, and when you said that in the video, I thought, oh my gosh, I didn't even realize that. Now that's men and women both.
Correct.
Right? Okay.
Correct. Yep.
And that's up until a certain age, correct?
Right. It's kind of the process throughout our life. But as women, estrogen plays a huge impact on or role in bone formation, and we know that when our estrogen levels really start to decline following menopause or during menopause, that remodeling speeds up. So it can be about up to 5 years instead of up to 10 years as far as our skeleton. So during those years following menopause, if we're not exercising, strength training, eating well, taking the right supplements, we may not be putting enough bone building cells back in there, our osteoblasts.
And when you said that, I thought, oh my goodness, I didn't even realize that our bones regenerate, so that the thickness of our bones that was 20 years ago is totally different than what it is right now. We could have been very, very strong back then, but depending on what we do to our body, what we put into our body, how sedentary we are, those bones could be even getting
worse. And that's truly what usually happens, is as we age, we know that both men and women over their lifetime have, a much higher risk of osteoporosis. I think the The numbers are 1 in 3 women and 1 in 6 men. But really, I think we're even going to see more as we see more and more people on medications, more people with not very good diets, more stress, and those type of things. So we are constantly remodeling, and as we are progressing through life, our bone density is decreasing over time.
And you were talking about a lot of the different things that affect that remodeling and how dense those bones are. And when I heard you talk, there was a number of items that you mentioned I could personally relate to, which I went, oh, goodness, I didn't even know that. So talk about what some of those things are.
Well, several of the things, boy, and there's a whole list, but I'll start a little bit with medications. Medications can play a huge role in reducing our bone density. And if we have had periods in our life where we've been on any type of steroid products, steroids, inhalers, maybe some asthma medication.
Like prednisone. They use that a lot for people.
Yes, they do. For pretty much any inflammatory type illness, they use prednisone or situation. So that will reduce your bone density. The other thing, probably one of the most popular prescribed medication is what we call our proton pump inhibitors for GERD, gastric reflux. So Prilosec, Prevacid, any of those type of medications actually will reduce the absorption of calcium in your body. So that will decrease bone density as well.
Is that why Tums adds calcium?
Possibly. And
I'm just thinking,
exactly,
Yeah.
And Tums is one of those things. The unfortunate part, I know my stepmom had gone to the doctor and in Seattle, and the doctor says, well, you've got osteoporosis, just take Tums. And I go, wait, that prescription, is about 20 years old. So don't be going down that road, because you really need the acid in your stomach to be able to absorb the calcium. So that's not the best choice of calcium replacement. And it's the same with your Prilosec and your Prevacid and those type of things, because it's reducing the hydrochloric acid in your stomach, so your body is not absorbing that calcium. So it's really contraindicative for good bones or those type of medications.
When you mentioned asthma, and the albuterol and Advair and all the inhalers. Excuse me. My asthma's kicking in talking about it. Inhalers, I'm thinking about all the children that are now being diagnosed with asthma and being put on that when their bones are starting to develop.
Exactly. And what we talk about, too, is developing what we call peak bone mass. Peak bone mass usually occurs somewhere in their early 20s. And what we're seeing today, and that's why I know osteoporosis is just going to be a very expensive epidemic for us, because we're seeing kids that aren't exercising, who are on inhalers, who aren't drinking calcium, who are drinking more pop, who are living a sedentary life, and all of that is contributing to a much lower peak bone mass. So they will never achieve possibly the bones that we had as children. And so their peak bone mass starts out lower, and then as they go through life, it's going to get less and less.
So when you hit your peak bone mass, that's as dense as they're ever going to get, and that's probably when you're a child.
About 20-ish, in the early 20s, yes.
So if you start out at a lower bone mass,
right,
you're always going to be lower.
Exactly. And that's the really scary part that a lot of people don't realize.
Now, let me ask you a question. You were talking about medications. There's been a lot of discussion lately about the medications for making your bones
like
better.
The osteoporosis,
Boniva, those kinds of things.
Yes.
And you made some comments in your video about what those actually do.
Exactly. Those were highly prescribed in the last probably 15, maybe 20 years. For osteoporosis and even osteopenia. If you're headed down that road, they want to prevent it getting any worse. And what they have found is that those medications will actually slow down the osteoclasts, which break the bone down, but it will continue the osteoblasts, which builds them up. But we aren't inside the bone. There is a matrix, and in one of my slides on my video you can see it, but unfortunately it's not on that video. And the matrix is critical, because if we don't have a matrix, we don't have anything for the calcium and the magnesium and all those good minerals to stick to. And so it's building up the outside of the bone, and it looks almost like a vase. If you took it like a bud vase, where it's really hard and dense, and we're seeing people having spontaneous femur fractures. And femur bone, which is your thigh bone, is the largest, most strongest bone in your body. And we were women, especially women, I don't know, there might be some men's cases as well, but they might be walking. There was one lady that was jumping rope, one lady that was moving just a piece of furniture, and all of a sudden they had a spontaneous femur fracture. And they're very bad and debilitating injuries. Several people have died from these, because it's very hard to heal from it. So those type of medications now are being limited, and physicians are saying you can be on them for up to 5 years.
And because that's when your bones regenerate, right?
Possibly.
Oh, okay.
But again, as we look at it, okay, what happens after that 5 years? And, even at 5 years, is there still a chance? Possibly.
And you've heard about people, one of the big things with seniors is having to have hip replacement because their hips break.
Mm-hmm.
And so my mother fell and broke her hip. And there was always the question of, did she fall and break her hip, or did her hip break and she fell? And that could be exactly what you're talking about, is
Yes.
that it
Yes.
breaks and then you fall.
Exactly. And I have another friend whose mother actually passed away because she was walking and either fell or her pelvis broke. And it ended up, she bled to death before they could get her to the hospital and in surgery. And so she had osteoporosis as well. So there's a lot of things that can happen, and that's why it's just so critical that we know where we're at and kind of understand other options as well, besides just those bisphosphonate type medications.
So when you go in and you get a bone density test, that is not the best you could ever be.
No. Again, it depends when you start your bone density test. If I went in, today and got it, I might be at the best I'm going to be. But down the road, when we take these medications, most of them cannot ever rebuild our bone to our peak bone mass.
Right.
We might be lucky if we get a few % increase in bone density with those. Usually maybe 1, 2, 3 at the most. Some of the best results are coming from our what we call our resistive weight training, and we're seeing that those actually have much better results than our medications.
And why would that be?
It's because when we put stress on our muscles, like doing resistive weight training, it also stresses those bones, and it will help improve the osteoblast, building the bones. And I'm sure there's enough of if we're not on any medications, usually we're having more bone breakdown than we are building. So exercise will actually help those cells build better. So you're actually having a better building. And one of the early researchers, Miriam Nelson, who has written probably 8 or 9 books on osteoporosis and that type of thing, it was down at her hospital that they started doing this early research on what we call slow resistive exercise. And they found that that was the one thing that would reverse osteoporosis, was slow resistive exercise.
And that's not just walking.
No, it's not just walking, unfortunately. It would be great if it worked, but it's actually getting into a gym and usually working with a personal trainer and going through a set of large muscle exercise. So it might be a leg press, could be a chest press, it could be a lat pull down, a pull up, a row, a leg extension, leg curl. Those type of large muscle exercises will help increase that bone mass.
And one of the things that you had talked about was in 2020 that 50% of the population.
Right. We're going to be at risk, wasn't that?
Yes.
Yes.
50% would be at risk.
for osteoporosis, meaning that we've got a whole group of people out there that have not reached good bone mass, peak bone mass, and we've got a lot of them that are sitting in the osteopenia area.
And these could be people in their 40s who aren't even thinking about it.
It sure could be, and it might even be people in their 20s, especially if they've had an eating disorder or if they haven't taken care of themselves. We see people with a lot less bone mass than we did back when we were children.
Well, we were always having to drink our milk and having to go out and play.
Mm-hmm.
And doing all of that. You didn't see a lot of the asthma.
Exactly.
So you didn't see the kids on the medications.
Exactly. Yeah.
Good grief.
I know. It's rather scary.
And you know, being a woman, when I would go in for my physical when I was 50, they started doing the bone scans on me.
Mm-hmm.
I asked my husband before we did this interview, who's 65, and said, have you ever had a bone density scan? And he said, no one's ever said anything to me.
That's right.
And I thought, now that's scary because men are at risk for this too.
Yes.
But they are not told, now it's time for you to get one of these.
Exactly. And I think what physicians need to do or practitioners need to do is to take a look at the risk factors for both men and women, and really help people to understand at an earlier age, yes, you could be at risk for osteoporosis or osteopenia. When I even did my cardiac and pulmonary programs, I would talk to my medical director about it. And I said, some of these men need to get in and get their bone density done because they did have osteoporosis. And they kind of hem-hawed around because there wasn't a good prescriptive medication that they could give them. But now that we know so much more, that there are supplements, there's exercise, there's so much more we can do. So we shouldn't limit that just because there's not a good prescription we can write them.
Right.
Yeah. And I think men and women both need to have their bone density done.
I agree. Well, we need to take a break, but I want to continue talking about this because it's very important to your health, and you really do need to pay attention to this. So we're going to take a break, and we'll be right back. It's been happening to me all week. Yeah, I asked him, and my husband is one of those that, he'll run to the doctor if he sniffles.
I know.
And he said, no one's ever said anything.
Most don't for men. And I didn't really want to throw my doctor under the bus, but he told me, he goes, finally, I'd bugged him. And he goes, Lynn, the only thing we can give for men is testosterone, and a lot of them don't want to be on that. Well, and that was, probably 15 years ago.
Yeah.
And I'm like, really? That's so, but there are so many more products. We just need to identify, and we need to educate on what they can do.
You had mentioned estrogen, and I remember hearing you talking about testosterone. So can we kind of
go back to that?
Start that
sure.
down
Let me look
Yeah.
back here. Both testosterone and estrogen. Yes.
And you had also talked about a smaller stature of person versus a larger stature.
Right. I can go over a few more of those risk factors too if you want.
Yeah.
Because I only covered medication.
Okay. And so we were still talking about men. So
okay, we'll continue on that,
and then
we'll kind of, yes, and then I can pull in a few of these others.
Yeah, see, I wrote notes.
That's good.
Okay, you ready?
Ready.
And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Lynne Kinson here, and we're talking about osteoporosis, and something that I didn't really realize until I started watching a video of her talk, and then she and I talking, that men are at risk for this too. I didn't even think about that. I don't know why. But you had mentioned earlier about how testosterone or how estrogen affects women. What about men?
Men. Well, that's true. And most of the time when we think about men, we think about testosterone. And men need both testosterone, and they have some estrogen in their body, so they need both testosterone and estrogen for good bone health. And they actually convert testosterone into bone-preserving estrogen. And but the other thing we're seeing with men today is a lot of men have low testosterone.
That's what I was just thinking.
Yes, they do. And that's been causing other health issues, whether it's infertility, some bad cholesterol, some cardiovascular disease. And as men tend to gain weight, especially around the middle, it seems like their estrogen level tends to go up a little bit more. Don't ask me how that's going to look down the road for their bones for sure, because I'm not sure, because they do need a certain amount of testosterone. Early on. So sometimes they're prescribed testosterone creams and things like that. And it would be interesting to take a look at how that's all affecting their bone mass.
And I wonder when all of those changes are happening in their body, if that changes their clock for their regenerating of bones.
Possibly so. It very well may. So in addition, though, to that whole testosterone, estrogen, there's some other risk factors that do affect men too. Alcohol, if they drink much alcohol, that can reduce their bone density. Smoking definitely reduces bone density. Smokers have a very high rate of osteoporosis. If they have low vitamin D, and that's probably one thing that people can really take action on, is taking a vitamin D3 supplement. And we know now, too, that there's a vitamin called vitamin K2 that plays an important role in that bone formation. So taking a D3 with a K2, either combination supplement or an additional supplement, will help with that bone mass. We know that magnesium is really important. And we used to think, magnesium is kind of one of those join up. It's usually found a little bit in vitamin pills and that type of thing. But what we're seeing is that a lot of people kind of have magnesium deficiencies because they're not eating a lot of the foods that contain magnesium. And I had just written down, I was looking at one of the sites that actually people who eat higher potassium and magnesium throughout life will have a higher bone density. So it's really important to make sure you've got those two nutrients.
Yeah, we had talked a few months ago on here. We had Dr. Halowitz on talking about vitamin K2. That's the first I'd ever heard about it. Right. And he was saying how that helps your body absorb the calcium.
Yes, absorb the calcium, exactly.
So I've been looking for foods with that, been paying a lot of attention to that. But there's a lot of risk factors.
There are for osteoporosis. So being sedentary. Our population is very sedentary. I mean, we really have to work hard to get exercise these days. So if we have a desk job, if we sit, if we drive, if we do a lot of that, and we're not really actively out exercising, and especially if we're not weightlifting, we are at a higher risk for osteoporosis. I talked a little bit about diet, but if you're not consuming calcium and calcium throughout your life, if you're a soda pop drinker or a heavy coffee drinker, or energy drinker, you're at a higher risk for osteoporosis as well.
A number of the different risk factors that you have brought up, I associate with diabetes.
Exactly.
So would someone with diabetes even be at greater risk just because they have it?
Yes, and if they're on insulin too, they're at higher risk. So it's all a metabolic process. And so we all have to... If you are diabetic, I definitely make sure you get in and get your DEXA scans and make sure that you're taking, good nutrition, good supplementation. You've got your vitamin D3, your calcium, your magnesium, your K2, and now another one is boron. It's a micronutrient, and I was listening to a speaker on it, and they think the next time the RDAs are redone, that's going to be included as a micronutrient as well.
Interesting, very interesting. What other medical conditions put you at risk for having osteoporosis?
That's a great question. Other things, besides, of course, the stomach and that type of thing, if you have thyroid issues, you're at higher risk. Again, the metabolic processes of, storing and absorbing calcium. If you have cystic fibrosis, if you have any type of, kind of inflammatory type disease, you're probably at higher risk for osteoporosis.
So it sounds like if you have anything, you're going to be at high risk.
Just to be alive, I think you're at risk.
Yeah.
But that is true. There's a lot of different things. Crohn's disease and a lot of irritable bowel, which we see a lot more. Or sometimes, if you, on any of those digestive illnesses, you're probably not absorbing your nutrients, especially your calcium, magnesium, those different ones. So you're at a higher risk.
Now, and you can actually have too much calcium in your system.
You can. And, the key, too, is sometimes your body will excrete calcium, and it just depends on what's going on as far as the balances go. It is really important that we're getting calcium A from good food sources and that we have the other nutrients in combination so it gets absorbed. Back to the magnesium. Magnesium, I talked about the internal structure of the bone. It creates that matrix. And magnesium is really a vital part of creating that matrix. So that's why it's important that we have magnesium and we have enough of it. Because if we don't have that internal matrix, we end up with that vase again, where we can,
it can shatter real easy.
Mm-hmm.
One of the things that you also had brought up was talking about seniors with the curvature of the spine. Where does that come from?
Well, what happens is over time, there becomes what we call microfractures in the bone and in the vertebrae. And when that happens, we see, our vertebrae kind of compress, and we see a kind of a rounded look. And that what we call dowager's hump is kind of a traditional osteoporotic indicator.
And that's because those little tiny bones are breaking.
Right. Breaking and compressing, and it just kind of makes a rounded hump in the top of your back.
And so let me ask you another question. So those little tiny bones in your back are broke, and now your bones are regenerating. Do they regenerate broken? So because you would stay that way, correct?
Right. They're definitely, that's a good question. I never really thought about that question, but that's okay. I have seen people with the dowager's hump, and I've seen people improve. But it takes exercise. It takes stretching. It takes some strength training, because part of that not only comes from the microfracture in the vertebrae, but it also comes from our inability of using those muscles, moving. And I had one little lady that came into our osteoporosis program when I was doing the exercise, and she could hardly pick her head up enough to look out the window. She was so humped over. And by the time, probably a year into the program, she was able to stand up much straighter. She came to us with a walker. We got her walking. And it was amazing, the changes. But we got her much stronger. We got her more stretched out. And we got her standing up straighter.
So they were regenerating stronger?
Probably so, exactly.
Okay. And if you were to do nothing,
they would just get worse.
Regenerate probably worse.
Weaker. Yes.
Because you're not
stimulating those bones to improve.
Okay.
Exactly.
That makes sense. That makes sense. One of the things you'd also talked about, and I think you kind of hinted on it when you were talking about the digestive system, was you were talking about the acidic and alkaline balance.
Yes, acidic and alkaline balance. And that I don't want to say it's new. It's been out there. A lot of people may not know it or understand it. And our body wants to stay at a homeostasis. So our body wants to maintain a neutral pH. But what happens is we expose ourselves to eating certain foods and certain environmental things that make our body tissues and things more acidic. And when we do that, our body draws out the calcium to neutralize it, to bring it back to its homeostasis neutral zone. So there are some things that increase the acidic, and that would be things like high protein diet. It could be things like dairy products, ice cream, milk, also alcohol, artificial sweeteners, even sugar will do that. Some other things that will do it too are prescription drugs are very acidic. And when we are taking those prescription drugs over time, it really creates that acidic environment and is another reason why it's pulling the calcium out of our bones. And stress. Stress creates a very acidic environment as well.
And that makes a lot of sense, because what we were talking about earlier, the risk factors
Right.
for having osteoporosis and more brittle bones, you had talked about alcohol, you had talked about medications, you had talked about all of those things. And part of what I was thinking when you were saying that, was why? Why would those things affect your bones? But now that
Right.
you say because it makes your system acidic, which draws the calcium out of your bones, then that makes perfect sense
Right.
why that would be a risk factor.
And the same even with coffee. Coffee creates a more acidic environment too. And so anything like that is drawing the calcium out, unfortunately. We can balance that out with eating things that are more alkaline. And so what I'll tell people is, if you're going to eat a hamburger or, drink a glass of milk, just make sure you have something like lemon in your water. Mineral water is very alkalizing. Grapefruits, oranges.
And those are things you would think would be acidic.
Exactly, because they taste acidic.
Right.
But the effect on our body is very alkalizing. It's the opposite of how it really tastes. It's not that way across the board, but it is, at least with those fruits. Some other things that are real alkalizing is sea vegetables, broccoli, yams, lentils, sweet potatoes, asparagus, pineapple, raspberries, tangerines.
All stuff that's good for you.
Exactly. So most of your fruits and vegetables are fairly alkalizing. And then another thing that's alkalizing to our body, which we don't often think about, is deep breathing, relaxation, yoga, some of those things that just really calms our mind and calms our body as well.
So, yeah, because again, you were talking about all the things that put you at risk, and one of the things you said was soda. And I'm thinking artificial sweeteners, one of the things, diet soda, and they put lemon flavor in a lot of diet sodas. I'm thinking, they're trying to do something here.
Possibly.
That's not really sounding good. But it could very well be.
Possibly, if they've thought that far ahead.
Probably not, but but it's really interesting that the things that you put in your body and how your digestive system really controls everything, and you don't really think. You think your digestive system, I've got a stomach ache, or I've got acid reflux because of what I put in my stomach, or I'm getting heavy because of what I put in my stomach. Right. You don't think that what I put in my stomach is actually taking calcium out of my bones.
Exactly. We don't think about a lot of those things, or, am I eating foods that contain potassium or magnesium or, those type of things. And how is that affecting my bones? But we don't think about the best foods really for our body, or the worst foods.
Well, and again, with our body, we think about things that we can feel. So you can feel your muscles, you can feel your stomach, you can feel those kinds of things because they have nerves associated with them.
Exactly.
But your bones, you can't really feel that they're getting weaker or stronger.
It is definitely called the silent disease, because you don't know. We don't know how our bones are doing unless we have a test that will determine that. And in addition, I don't know, DEXA scan is one. It's probably the most common one that we can find. But if you have a CT scan, that is another great way of finding out how your bones are doing as far as bone density. So while they're scanning you CT-wise, you can ask them, can you tell me my bone density?
And that's one of the things that they get from those scans.
They can, yes.
Very interesting.
Yeah. So there is a variety of different things. They also sometimes look at to see how much maybe calcium you're excreting and that type of thing. It's not a super test to tell you how your bones are doing, but it may tell you how maybe your supplements or your medication's working.
So when you have do one of those fasting blood tests, because I remember looking at my results, and one of the items on there was calcium, and I thought, okay, I wonder what that's telling me.
Right. It really doesn't indicate about osteoporosis, but it will usually tell you how your circulating calcium is doing. Your circulating calcium might be okay, but you still might not be absorbing it very well
Right.
because you may not have the other nutrients you need.
And that's something you really have to be careful about. I had a lady friend, and that's why I mentioned the Tums, because she was going through a lot of emotional things. She had lost her husband, and she had osteoporosis, so she was taking calcium supplements. She had calcium in her multivitamin,
Right.
and she was nervous and upset because of all the family coming and everything. So she was taking multiple Tums throughout the day.
Yes.
And she started really having problems, and they took her into the emergency room and did a test on her, and her body had OD'd on calcium. And it was causing her organs to shut down.
Oh my.
And you really have to be careful.
You
You
do.
can pump so much, and if it's not being absorbed
Right. Or excreted.
or
Yeah.
excreted, that can cause a major problem.
It can, because calcium is critical in our heartbeat, our muscle function, our nerve impulses. So it's definitely very necessary. But yes, too much can cause
And you've got to
very
be
bad
careful
issues.
because it's in some things like the Tums that she was taking for her stomach. Didn't even think about that there was
Right.
other stuff in there.
Exactly, or really what it might be doing to her.
Exactly. Well, we need to take another break, but I want to continue talking about this subject because, again, it is something all of us, men and women, do need to talk about. So we will be right back.
Yes, that is so scary. And there's some people just by the hereditary that will absorb calcium better and the nutrients and have amazing bone density. And then there's some that,
No matter what they do.
exactly, that is like forcing it in there. Yeah.
Okay.
What other things
Yeah.
here?
What haven't I?
Let's see. We could talk a little bit more about uh, sources of calcium
Okay.
and calcium supplements. The other thing is like cancer medications can cause osteoporosis. Cancer
Is that
treatment.
because it changes the pH in you? Or?
Well, could be one of the components, but I think it really probably it may just totally mess up your osteoblasts, osteoclasts.
That whole rhythm.
Exactly.
Okay.
Yep. Um, and then there's been some out there there was a couple more things that I got off of Dr. Oz the other day. I was watching. I went, oh, that's helpful.
Yeah, he does have some things
Yeah.
on there.
I know, citrus. He said that vitamin C will cause less bone breakdown, so maybe less bone of the.
And that's the lemons and the
Yes.
grapefruits.
Well, that's probably true right there. Yes. Yep. That's probably it exactly. And then he said prunes. Prunes help slow down bone turnover too. And then, of course, eating a Mediterranean diet, which is, and I can talk a little bit more about
Okay.
that as well.
Okay.
And he also mentioned sardines. As much calcium as a glass of milk and vitamin D.
And it's probably alkaline.
It might be. I'll have to look in my book. Well,
See, now that you gave me this tidbit of information, I'm like, wow, well, that's why this is this and this is that.
Sardines aren't listed. Fish is the least alkaline, but there isn't any that are most alkaline. So
What about meat? Beef?
beef? It's in the acidic.
My poor husband.
I know. The least acidic out of that is shrimp, turkey, chicken, game, and eggs.
So it's the white meat.
Yeah, more so. And the white meat and game and fish are probably the best.
My husband will probably never get beef again. He keeps telling me, don't have any more nutritionists on there. I can't have beef anymore. I can't have salt anymore. He said, I'm going to starve.
Oh, poor guy.
He's funny.
How funny. Oh, that's good. And we can talk a little bit more about vitamin D3. Do you supplement with that
Yes,
vitamin
I
D3?
do.
How much do you take?
3,000, 4,000,
Okay.
5,000.
Yeah, good.
I've had gastric bypass surgery.
Oh.
So I don't absorb.
Exactly.
So I take mega.
Yes. See, so not only if they're on any of those proton pump inhibitors, but if they've had gastric bypass.
Because you don't have
Yeah,
all the intestine anymore to do it.
Exactly.
Yeah, so I take all kinds of mega stuff. Plus, I don't eat meat anymore and all that kind of
All
stuff.
that.
All that good stuff. Like I said, my poor husband. Okay. Ready?
Ready.
Final one. And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Lynne Kinson here with me today, and she is, I would venture to say, our osteoporosis expert. I mean, I have learned so much from her today. I'm really getting dangerous. My poor husband will never eat anything again. I'm restricting him from everything, David, you know. You warned me not to have any more nutritionists on here because I've been changing your diet so much. Well, it's getting changed again.
We'll just put him on Greek yogurt.
There you go. Well, he's allowed to have that. But one of the things we were talking about is the sources of calcium during the break in foods.
In foods, yes. And there's a lot of good food sources because I hate to see people just take supplements. So, you know, if you can get some good food sources, that is ideal because you'll have a lot of different nutrients that also accompany that calcium source. But cheese and yogurt actually absorb in our body, the calcium in those two products absorb better than actually a glass of milk. For some reason.
And milk's acidic, so.
Yeah, exactly. Cottage cheese would be another source. Kale and broccoli, you know, sometimes we don't think about those greens, but they're a good source also
Of K2 also.
Of K2 as well as our calcium. So
Dr. Halowitz taught me that.
that's right. K2 is important. Almonds, you know, I eat quite a bit of almonds. And one of the studies I just read is that we really don't absorb all the calories that it says on the label that are contained in almonds. Maybe about 2/3. So they're a great source of not only calcium, but good protein, some complex carbohydrates, and really good omega-3 fatty acids.
And fiber.
And fiber, exactly. So I try to encourage people to have nuts, either almonds or walnuts, every day.
And they're a great snack when you're sitting there at the office and it's 2:30 and you've got to have something. I keep them in my desk.
Yes, I keep them in my desk, my purse, my car.
Yeah, absolutely, absolutely.
Never know where you might find them. Another product is tofu. Some people, you know, will eat soy, and tofu's got some calcium as well. And black beans. Black beans have calcium as well.
And that's what my husband gets to eat instead of steak.
Well,
now,
mix that black beans with maybe some ground turkey and some good vegetables.
Now, the soy, it also has estrogen in it.
Right.
Which helps you to absorb.
Yes. Possibly improving the osteoblast, the bone building that's going on in your body as well.
And talking about the bone building, you had said something during the break about cancer treatments.
Yes. If you have gone through cancer and have had cancer drugs, you have an increased risk of osteoporosis as well. So, you know, I've actually gone and talked with a cancer survivor group on osteoporosis because most of them will end up with osteoporosis. So it's really important that they get on some good supplementation. They're taking, you know, good not only calcium, but like we talked about, magnesium, the D2, the boron, K2.
All of that.
D3, K2, sorry. All of those.
All the letters and numbers.
Exactly. And then that they're doing the exercise as well, because we know that resistive exercise will help rebuild some of that muscle, because they often lose muscle tissue during cancer treatment too.
And we were talking that maybe one of the reasons for that too is it disrupts that cycle.
Yes, the bone, the osteoblast, the osteoclast. So we're not seen as good of osteoblast activity, so they're not getting that bone rebuilt.
So what if a child has leukemia and they're having cancer treatments as a child?
Right.
That will affect...
It can affect their peak bone mass as well. And so for those little people, you know, nutrition is critical, exercise is critical. You and just doing the best you can to help them achieve as good a peak bone mass as they can in their early 20s.
So it sounds like that there's a lot of things that parents really do need to be aware of if they've got children with medical issues, that
Right.
you're not just treating that particular medical issue, but you're also possibly affecting their bone density for the rest of their life.
Exactly. And maybe some of their nutrient levels in their body, because they probably aren't absorbing a lot of that.
And you talked about some of the sources for calcium. There's also a number of types of calcium supplements.
Exactly. There are. Probably the most common ones used to be, I talked a little bit about Tums, but calcium carbonate and calcium citrate. Those are probably the most common two on the market. There have been some studies out, though, in the last few years that have shown that taking calcium carbonate and citrate actually increases our risk of heart disease. And it's because, calcium carbonate is like a rock. And it returns to a rock in your body. So it actually creates the hardening of the arteries. And I think Michael in my presentation had quoted a study that said when you take calcium carbonate citrate, that your risk of heart disease increases by 50%. So if you're going to take a calcium supplement, we really suggest you look at plant-based calcium. And some of those would be that algae calcium that's derived from algae from the sea. But there's some good ones out there. There's also some that contain some strontium. There's 2 or 3 different ones. And strontium is a component that actually helps us build that bone matrix. And that, again, is critical to maintaining the bone strength and bone health. And it gives the calcium and those other minerals a place to land.
So just because you're taking calcium supplements doesn't mean you're building your bones.
Exactly. You can be throwing, let's say I'm just taking Tums or calcium carbonate or citrate, and especially if you're not taking the rest of the minerals that go with it, the D, the magnesium, the K2, the boron, and you're not exercising, the calcium may be coming in and may be going right back out. There is nothing for it to create it to stay in there. And like I said, that strontium will help with that matrix.
Is there anything that it increases your risk for heart disease by 50%? Is there anything that would decrease that back down?
I would just make sure that if you were taking calcium carbonate or calcium citrate,
Right.
that you change. You go more to a plant-based calcium
Okay.
right now.
Okay.
And that will help slow that down. But, another thing is make sure you get those carotid artery ultrasounds done. That'll probably give you a good indicator of what you've got as far as stiffness and hardening of your arteries as well.
Okay. Interesting. Now, there was something that we were talking about before about your diet and how your diet can affect it. And we were looking at something for proteins. And you were saying how beef is on the acidic side.
Exactly. Yes. Protein is important in bone mass, so it's important we have enough protein in our diet. And there are definitely a variety of protein sources. I mentioned Greek yogurt. I think it's one of my favorites. And, like the Fage brand, it's spelled F-A-G-E. I think that one has like 23 grams of protein and only 9 grams of carbs per cup.
Oh, nice.
So, yeah, it's great. And I use it to make smoothies, and so it's a good source of calcium, about 25% of your RDA for calcium, and it also has good protein. But some of your meat sources or other protein sources, most of them are more acidic, like we talked about, like lobster, of course, hot dogs, deli meat, fast
those are
foods.
Bad.
Lean red meat and veal are even fairly acidic. But as we start to look more at our healthier meats, like our fish is probably the least. It's the most alkaline out of all the meat products. And then, of course, following that would be your shrimp, your turkey, your chicken, game, and eggs. And I'm a big proponent. We live in North Idaho. There's a lot of game out there, and it's a great choice because it doesn't contain hormones or antibiotics. It has better fats in it. these animals have been running around the woods eating everything natural, and so that's a higher level of what we call omega-3s versus the really inflammatory omega-6s, which comes a lot from our feedlot beef and pork and those type of things. So if we can lean that direction, we're doing our bodies a big favor.
So the big important thing to leave with is that men and women are at risk for osteoporosis. And as us women get older, our bones regenerate at a faster pace.
Exactly.
So that we might have been perfectly healthy at age 50.
Right. Maybe prior to menopause, we might have been looking pretty good.
But then after that, as it now starts regenerating every 5 years,
Yes.
we have a better chance of either getting healthier or worse.
Exactly.
And most likely it's going to be worse because we don't do all the things we used to do.
And should be doing.
And should be
If
doing.
we're not actively lifting weights, taking our supplements like we should be, eating well, reducing the stress in our life, eating these healthy foods, and probably also taking our healthy plant-based calcium, we probably are creating worse bones as we age.
So it's really important. And I would say that, at age 50, they say women need to do a bone density. I would say men need to do the same thing.
I would say so too. You know what? You might have a few practitioners that balk at that. And again, take a look at your risk factors though. If you've ever smoked, that would probably be a big risk factor. If you've been on medications that interfere with calcium absorption, if you have low vitamin D3, if you maybe have low testosterone,
if you're
diabetic or thyroid issues, those are all risk factors that would warrant a DEXA scan.
And I wonder, we have a lot of veterans here in our community. And now that those folks in their 60s and early 70s who served in Vietnam and were exposed to Agent Orange.
Exactly.
That might have affected, and that was when our guys were 20 years old.
Right. Exactly.
Which is when they should have been at their peak bone mass.
Exactly. And now we know, well, we don't even probably know all the effects of Agent Orange, but it was very detrimental to their health. It increased the risk of prostate cancer.
And all kinds of different things,
Yes. So, yes, especially I would say if you're in your 60s and 70s, get a DEXA scan. And, I always say start earlier. I was probably in my 20s the first time I got one done. I volunteered as a researcher. But it's good to know where you're at through each stage of your life. Because if you already are not where you should be, that's the time to take action and do something about it.
Good point. Well, this has been so very informative, and I am so glad you came on with me today.
Thank you. It's fun to talk about.
Oh, absolutely, absolutely. And, if we can just help one person out there to realize that they are at risk and that there are things they can do.
Exactly.
And if we can prevent a person from breaking their hip.
Yes.
Because that goes to a whole nother ball game when that happens.
A lot of care.
Yeah. Then it is so very worth it.
Yeah.
Now, if someone wants more information on this subject, what should they do?
Well, that's a great question. I definitely... I have a Facebook page. I used to have a website, and everything was just getting so hard to maintain. But Farmer's Daughter Lynne Kinson, that you can email me with questions. I have another good friend who's a great resource. It's Mike Teeter with the Exercise Institute, and he does the slow resistive exercise program. He actually has doctors that will write prescriptions for people to come exercise with him and reverse their bone density. So he and I work closely together. We don't really work together, but we refer back and forth. And, either one of us, feel free to get in touch. You can always email me at my email address, and it's lynnner2@frontier.com.
And that is so fantastic. And I hope that you get a number of questions because,
Thank you.
We don't get a lot of D here. D vitamin.
Yes. No.
And we've talked about it, for a number of reasons that the D vitamin is good, but it's really good to build your bone strength.
It is. It's good to build your bone strength. It's good to prevent diabetes, colon cancer, MS. MS is big in this area. So D3 plays a huge role in our health up here, and it's just really important that if you aren't supplementing, you probably should be, because I haven't met anybody who hasn't supplemented that had a good reading yet.
And it will increase your mood. It will make it a
Yes.
whole lot better.
Definitely
So-
decreases depression.
Yes. So thank you so much, Lynn, for coming on. I appreciate it.
Thank you, Connie.
And this has been the Senior Moment, and you all have a wonderful rest of your day. Good day.